name is Jocelyn Invernon. I'm a PN student at Williston State College. Today for my skills, we're going to be doing a medication administration. So to begin, I'm in my med room and I'm going to start by comparing my MAR, or my medication administration record, to my healthcare provider orders. So first things first, I'm going to make sure that I have the same MAR and the same orders for the same exact client. So we have Shirley Kosh. She's a 54-year-old female. Her date of birth is 5/14/1964, and her doctor is Dr. Leo, and she's in room 211-1. So on the provider's orders, it says Shirley Kosh, 54-year-old female, date of birth is 5/14/1964. Her physician is Dr. Leo, and she's in room 211-1. So those both match. So now I'm just going to go ahead and compare the medications to both, making sure that we have the same route, the same dosage, and order from the physician. So first we have Refresh Plus Lubricant Eye Drops, 1 drop in both eyes twice a day. Refresh Plus Lubricant Eye Drops, 1 drop in both eyes twice a day. We have a Fentanyl 50 microgram transdermal patch twice a day. Fentanyl 50 microgram transdermal patch twice a day. We have Augmentin 600 milligrams per oral twice a day for 7 days. Augmentin 600 milligrams per oral twice a day for 7 days. Ibuprofen 800 milligrams per oral every 8 hours PRN or as needed for pain. 800 milligram ibuprofen per oral every 8 hours PRN. And we have digoxin, otherwise known as Lanoxin, as 250 micrograms per oral daily. Digoxin or Lanoxin, 250 micrograms per oral daily. And last but not least, we have Paxil or paroxetine for 200 milligrams per oral daily. And same thing over here, Paxil or paroxetine, 20 milligrams per oral daily. So now that I've confirmed that all of my medications on my MAR match all my healthcare provider's orders, then I can start taking those medications out of my bin system and putting them onto a tray to take into my client's room. So to begin, I'm just going to make sure that this bin matches my client, her date of birth and her name, and make sure I have all the right meds for the right client. So I'm going to go ahead and I'm going to perform hand hygiene, and I'm going to apply gloves. So first I'm going to start with my eye drops. I'm just going to confirm that what I have in my bin is what I have on my MAR. So first we have Refresh Plus Lubricant Eye Drops, Refresh Plus Lubricant Eye Drops, and then a 50 microgram transdermal patch of fentanyl 50 microgram transdermal patch. And as I'm doing this, I'm also checking expiration date. I'm checking the integrity of the packages, making sure there's no tears or holes. Next I have Augmentin 600 milligrams, and I know that that's going to be oral medication, so it should probably be a liquid. So that is Augmentin oral suspension. Perfect. So I've got that Augmentin. Ibuprofen 800 milligrams. I have ibuprofen 400 milligrams, so perfect. And I have my digoxin right here. 250 micrograms. Again, checking the integrity of the package. They're not expired. And I know that with this one, I'm gonna have to go ahead and check my client's apical heart rate, because it's a arrhythmia. So I'm gonna go ahead and put that in a separate cup. So I know that when I get in there that I did that for a reason, and I need to check that apical heart rate first. And next is gonna be that paroxetine or Paxil. And that is going to be 20 milligrams not expired, and the packaging is intact. So I've gathered all my medications now. So next I'm going to go ahead and get the correct dosage in all my cups before I can enter my client's room. So I'm going to go ahead and do my Refresh Plus Lubricant Eye Drops, and I know I need 1 of those, 1 drop in each eye. And I'm going to return that packaging to my client's bin. And next I'm going to need that Fentanyl 50 microgram transdermal patch. I'm just going to go ahead and crack that open. I know that we're ready for that. And then Augmentin 600 milligrams. So with this, it's at 100 milliliters. So I know I need to do that dimensional analysis and I need to measure out in a liquid cup 7.5 milliliters. So this is a suspension. I'm going to make sure that I'm shaking that really well, and I'm going to pour it eye level, making sure that that meniscus is level with that 7.5, and that is perfect. And when I would hold this, I'd make sure and cover that label. If I were to drip that on there, it could ruin the integrity of that label, making it hard for other providers to read that or other nurses. So making sure to cover that. And I have that in there correctly. And next I'm going to do my ibuprofen. So before I started, I went in and checked my client's vital signs, and she informed me that she was having pain in her right knee. And on a scale of 1 to 10, that was a 6. So she said that she was requesting some ibuprofen, so I'm going to go ahead and give that as needed ibuprofen. And I also needed to do dimensional analysis on this because it calls for 800 milligrams and this is 400 milligrams. So I know with that I'm going to need 2 tabs to get the correct dose to my client. So 2 tabs right there and there. I'm going to return that to my client's bin. And next I'm going to make sure that the digoxin is the right, and it looks like it is 250 micrograms is ordered, but I have a 0.25 milligram tab, and with my dimensional analysis I know that that is a correct dose. And the same for my Paxil or paroxetine. We want to make sure that's ordered at 20 milligrams, and that looks like it's a 20 milligram tab. So with this, I'm going to go ahead and take my gloves off and head to my client's room now that I'm ready. So I could leave this in the med room with my cart locked up, or that's what I'm going to do. So I'm going to enter my client's room. I'm going to knock on the door and provide privacy first thing. So I'm going to introduce myself. Hello, my name is Jocelyn Imbernaude, and today I'm going to be your student nurse. Can I just get your name and date of birth? Shirley Cost. Okay, you're born 5/14/1964. Perfect. So I'm going to go ahead and check my client's allergies first thing. It looks like she is allergic to promethazine and codeine, and that is exactly what it says on my MAR. So that is confirmed. I'm going to raise my client's bed to a working height for me, and I'm going to go ahead and sit them up. Shirley, it looks like I have some medications here for you. So I'm going to go ahead and do hand hygiene once again and get a new set of gloves on. Okay, so first we're going to start with your eye drops. The doctor ordered some lubricant eye drops. You have a little bit of dry eye. So before I would administer my client's eye drops, I would make sure to assess their eyes, make sure they're not dirty or anyway, there's no nothing that could get in the way of those eye drops. So I would come in with a clean washcloth, and if it was, I would wipe them, making sure that they're clean. And I'm going to, as I go, I'm going to just go ahead and explain to my client what everything is what we're going to be doing. So Shirley, it looks like we're going to be doing eye drops in each eye. So I'm going to go ahead and open that, and I'm going to pull down your lower lid, and just making sure that I get 1 drop in that eye and 1 drop in that eye. So that's done. Next I have fentanyl 50 micrograms transdermal patch. So before I administer that to my client, I'm going to open the packaging up, and I'm going to make sure that I initial and date with a Sharpie on that patch. So the date is perfect. There we go. And Shirley, this is for your chronic pain that you've been having. So from my MAR, I know that the nurse before me went and put that on my client's left upper back. So I'm going to go ahead and have my client sit up for me, and I'm going to remove that first. Making sure that I have a alcohol prep to clean that and just cleanse that area of any stickiness. Now my client's up for me. I'm going to go ahead and remove that patch. And I'm going gonna fold this patch into itself and dispose of it per like policy of this facility that I'm in. For this purpose, I'm gonna just throw it in the garbage. I would change my gloves and I would go ahead and cleanse that same area with an alcohol prep, just making sure there's no residue on there. Okay, and with the new patch, I know that I'm gonna put that on a new area of my client. So I'm gonna go ahead and open that up, and on the new area, I'm gonna go ahead and put it on their right upper back. Perfect. So I'd go ahead and get new gloves this time as well, just making sure that I'm not going to transfer that fentanyl onto anything that I'm touching or any pens or the MAR or anything. And as I'm going, I'm also initialing that I have administered this medication. So I put that on her right upper back, which would be site A, and initial that. So next I have this Augmentin for you there, Shirley, that looks like it's for your pneumonia. So I'm gonna go ahead and put that in my client's hand, instruct them to drink it. Perfect. Give them a fresh drink of water if she feels like she might need that. Signing that off as well. Okay, ibuprofen. You told me earlier that you had some right knee pain. Is it still sitting at a 6 on that scale? Okay. So I'm gonna go ahead and give you that ibuprofen then. Here's that, you can take that. And here's some water to wash those down. Perfect, I'm gonna sign that one off. Okay, and it looks like we need to give you your digoxin or Lanoxin. So before I do that, I'm gonna just go ahead and check your apical heart rate. And when I'm doing this, I'm making sure to go skin to skin, not listening through my client's gown. I'm going to listen for 30 seconds or a whole minute. Okay, Ms. Cost, it looks like your heart rate is exactly where it needs to be, and I can go ahead and give you that medication. Okay, here is that digoxin. That is just to control your, there's that for you. That is just to go ahead and control your AFib. There is some water for you. Perfect. And next, it looks like for Pax, we have your Paxil ready for you. Making that bedside check on all my medications. This is just gonna go ahead and ease your anxiety, Shirley. I know that you struggle with that. So there is that. Offering my client water as well at the same time. Perfect. I'm going to sign off on all my medications. And once I'm done administering medications, I'm going to go ahead and take my gloves off. I'm going to return my client to a comfortable position, making sure that they're covered up, making sure she doesn't need anything like the restroom. She's comfortable. I'm going to return her to a comfortable position. And I would just make sure to, chart any new complaints she would have, chart that I've completed all of her medication administration, and let my client know that with that PRN medication, Shirley, I'll be back in 30 minutes to an hour to check on your pain, reassess. So I'm going to leave my client's room with everything I came in with. I'm going to chart and put all of her meds back in that locked cart.